Student, the supraspinatus muscle originates from the supraspinous fossa. This is the supraspinous fossa of the scapula bone. So the supraspinatus muscle originates from the supraspinous fossa and move laterally and a little inferiorly and passes under the acromion process. This is the acromion process and insert on the greater tubercle of the humerus bone. This is the greater tubercle of the humerus bone. So the supraspinatus muscle originates from the supraspinous fossa and move laterally and inferiorly and pass under the acromion process of the scapula and insert on the greater tubercle of the humerus bone. Now student, moving toward the blood supply of the supraspinatus muscle. Student, the supraspinatus muscle is supplied by the suprascapular artery. Here this is the suprascapular artery. This highlighted artery, this supply the supraspinatus muscles, and part of this artery also move to the infraspinatus fossa and also supply the upper part of the infraspinatus muscle. Now student, moving toward the innervation of the suprascapular muscle. The suprascapular muscle is innervated by the suprascapular nerve. This is the suprascapular nerve. Now student, moving toward the action of the supraspinatus muscle. So the supraspinatus muscle is responsible for the abduction of the arm, and it is also one of the muscle of the rotator cuff, so it also play important role in the stabilizing of the shoulder joint. Now student, as we have discussed the anatomy of the supraspinatus muscle, now we will overview the supraspinatus muscle. The origin of the supraspinatus muscle is supraspinous fossa of the scapular bone, while it inserts on the greater tubercle of the humerus bone. The action of the supraspinatus muscle is the abduction of the arm, and it stabilizes the shoulder joint. The blood supply of the supraspinatus muscle is the suprascapular artery, which is the branch of the subclavian artery, while the supraspinatus muscle is innervated by the suprascapular nerve.